Since mid-October, a cholera epidemic has been raging in Haiti. According to the Haitian authorities, it has led to more than 1,000 deaths in 3 weeks.
Les premiers cas ont été vus la troisième semaine d'octobre.
The first cases were recorded during the third week of October in the Haiti region in the center of the country and spread relatively quickly throughout the region. Since then, it has spread through the rural areas across the country, and it has now been nearly 2 weeks since the epidemic has really taken hold in Port-au-Prince.
Cholera is an acute intestinal infection transmitted through contaminated water or food that leads to watery diarrhea and vomiting. It can be fatal if not treated in time.
The
little girl was admitted at about 3 or 4 o'clock this morning. They asked me to come and see her. They were worried about her condition. She was severely dehydrated. Unfortunately, she arrived too late for us to save her.
Treatment consists of intensive rehydration, orally for simple cases, intravenously for the more severe ones. Médecins Sans Frontières quickly set up cholera treatment centres near the areas where the epidemic broke out in order to effectively care for the patients.
With complicated cases, there is a very fast evolution of the disease. In the morning, the person can feel normal, then have a little diarrhea, and by the afternoon can be in the hospital in shock, already dehydrated. That's why it's very important to have health facilities close by, in order for the sick to have rapid access to treatment.
Every day, MSF teams are receiving hundreds of patients, sometimes more than they are able to cope with.
We're really worried that we won't have the capacity needed to treat all of the cases. People are arriving in large numbers. Our hospital is completely full. We're having to refuse referrals because we know very well that we can't care for them.
To make up for the lack of space, other centres stabilise severely dehydrated patients before referring them to larger structures. Médecins Sans Frontières is increasing the capacity of its facilities throughout the country. At Sarthe Hospital in Port-au-Prince, a new centre with 320 beds has just opened. In the most isolated regions, like here in Zabricot in the north of the country, Médecins Sans Frontières is setting up new structures to try to reach the sick.
When we got here yesterday, there were only 2 patients here. They arrived progressively throughout the day, but it was still manageable. Today, first thing in the morning, there were already more than a dozen people here. Information must have spread by word of mouth in the villages.
The teams have already cared for more than 16,000 patients in 21 cholera treatment centres across the country. Most have reached their maximum capacity, and in certain centres there are more patients than beds. Every day between 1 and 200 trucks pass through the border crossing here in the south of the Gaza Strip next to Egypt. That's a third as many as 4 years ago when Israel set up the embargo. And it's too few. The needs of the Gazan people are not being met. In the central pharmacy that provides for hospitals in the Gaza Strip, certain shelves are empty.
Here there should be suction catheters. It's essential equipment in an operating theatre. But there aren't any to be had. We can't get hold of any kind of catheter. There are no cardio catheters available either.
Shortages of medical supplies, but of energy too. At Nasser Hospital in Khan Younes, power cuts are frequent.
What happened? So power cut.
It's always.
It's the second power cut of the morning during this case.
Due to the poor health care available, many Gazans should be treated abroad, but the Israeli government continues to refuse 25% of the 1,200 applications made for exit permits on medical grounds. Mohammed is waiting for one of these precious permits. Wounded in the leg by a shell explosion during an Israeli incursion, he underwent surgery last April, but he has developed a bone infection and needs another operation, an operation he can't get in the Gaza Strip.
The problem is that he needs a surgery urgent because the infection that he has in his leg is becoming to be worse, and that was the situation since 2 months ago. So right now, if he's not going out soon, he will lose his leg.
Despite international aid and a recent easing of the embargo, certain needs are still not being met. 4 years after the embargo was first set up, the people of Gaza continue to suffer from medical confinement. Every day, more people are contracting the HIV virus, and those already receiving treatment will remain infected all their lives. That means the number of people in need of care is constantly on the rise. And as World Aid Day approaches, on the 1st of December, Médecins Sans Frontières is keen to highlight this situation.
The only way to get so many people on drugs, on ARVs, is to find the simplest way to do it. At the same time, it's very important to know and to remember that this is lifelong treatment. So again, it's finding a balance. What can you simplify, but also being clear on what points you're not willing to simplify.
Patient care can be simplified in several ways. Using the new antiretroviral drug tenofovir, or TDF, is just one of them. This drug, which is more expensive but more effective with less side effects, has been used by MSF teams working in the Mathare slum in the capital of Kenya since May 2010.
It's a drug that you can give as a once-dosing drug, and it means that the adherence of patients also improve because they only have to take it at night. And that also means less pill burden. And also for health worker to manage it easier because it doesn't have so many side effects that you need to follow up patient. The only thing that you need to do for patient is check their renal functioning when you are initiating the drugs.
Task shifting is another way to simplify patient care. Faced with a lack of human resources, care normally provided by doctors has been transferred to nurses or non-medical personnel.
We have the nurse doing some of the consultations that traditionally a clinical officer or a doctor would have done. These are our more stable patients. We have set criteria for which patients the nurses can see.
Stephen Twitaek began treatment in Mathare in 2003. He's been coming to the clinic every 3 months ever since.
Right now I feel very okay. I feel strong, very energetic, and I am very supportive to my family. And I want to live a very long life, a normal life, just like any other person. So that I can see my children go through the schooling.
The simplification process also calls for decentralization, for care to be brought closer to patients, for new tests to initiate and monitor treatment, and to stretch out appointments for patients in a stable condition.
Hands off my medicine.
Hands off my pill.
Hands Off Our Medicine is a Médecins Sans Frontières campaign denouncing the looming threats to access to generic medicines. These threats have led to several protests. The most recent took place in October in New Delhi to speak out against the current negotiations between the European Commission and the Indian government. The discussions concern the free trade agreements that could block access to affordable medicines in developing countries. India is one of the world's largest producers of generic drugs.
You have to understand that India is the main source of generic drugs across the developing world. Today, India supplies 93% of the generic ARVs in the developing world. So if those are inhibited from being produced or marketed, it not only affects Indian people and their access to affordable medicine, but also impacts developing countries.
India is a favourable environment for the development of the generic industry, as criteria for patenting new drugs are stricter than elsewhere. Producers of generic medicines can therefore make and sell a large number of products patented in rich countries. It's this advantageous situation that the European Union is currently trying to undermine.
These demands are only meant to further line the pockets of multinational companies because it doesn't help either the Indian people, the Indian government, or even the European people for that matter. This is only for the benefit of a very few people who want to make more money at the expense of the lives and the health of poor people in Europe as well as in India and developing countries.
Hands off my pills! Hands off our medicine is a way to put pressure on the European Commission and to reaffirm the right to access to affordable and high-quality medicines.